How you doing?
I'm doing very well. How about you?
Doing good as usual. So I know you've been busy. Well, yeah, you're always busy. Yeah, until this pandemic's over, at least. So,
I I,
um,
I had a busy morning.
cool. With doing what? Can I
I had,
ask?
of course, I had the
Okay.
State of the City address today for presented to the Mississauga Board of Trade and hundreds. I don't know quite how many. Last time I checked, about 350 people registered. Live last year we had 650, but I'm hearing about in between was the
Nice.
last count. And not
How's my?
sorry.
Sorry, go ahead. I was gonna say, how's my boy David Boychuk doing?
He's great. He's great. It just gives
Yeah.
me an opportunity to update on the past year and our plans for the following year, next year, and talk about, what mitigating measures we took to stabilize the ship, and we did quite a number, as you know, and what the plans we have for 2021, and hopefully it'll be better than 2020. It can't not be, right?
100% it'll be better than 2020. So, a lot to ask. Two main subjects we're going to be talking about is the red zone and vaccines. So let's start with the red zone. Is Mississauga going to get into red zone on March 9th?
So I was really hoping we would, and I think we should, but I just received the latest epidemiology report, and I have to tell you, it's not promising. Um, our case counts are up, only marginally, but still up. We were at 73.2 cases last week, and we're at 74.2. So we did go up. Brampton's up quite a bit too. They
Okay.
were at 115 cases, now they're 128.
Okay.
Khaled, they're up as well. They were 66 cases, now they're 72. But that's not the concerning number. Last week, we all had R factors in a 0.9 range. Now we're all over 1, which means that guaranteed every person with COVID will infect at least one other person, but it's higher than 1, so it'll be more than one person. So your numbers can't
Uh,
go down when you have an R factor over 1. And then the positivity rates, actually ours is okay. Ours was 4.5 last week, it's 4.8. That's not bad. Brampton's was 7.4 and they're 8.7. So
so,
those are not good things. And we did have a briefing from Dr. Lowe yesterday, and it was yesterday, last evening. He presented a deck to us, and it's really the rise of the variants that are so transmissible. And he was showing us on charts and graphs that imitated results from experience in Europe and some places in the United States, mostly Europe, and that just showed that this is the time to lock down, not time to open. So will we go into red? I don't think so, but I'm hopeful we will go to gray and then keep things under control and continue to be on the right path to go to red. I think, I think I'm fairly hopeful we will go to at least gray so retail can open with minimum capacities, 25% capacities. It's the restaurants, the gyms, and the personal care services that can't open in gray, only in red.
okay. So I guess my next question, and I think you kind of answered it, was, what does Dr. Lowe, the Peel Chief Medical Officer, think of Mississauga and Peel going into red zone? I think you kind of answered it, unless you want to add more. So,
So, I think he's hard pressed. He and Dr. Davila in Toronto are hard pressed because they are factors to even go into gray. But I think because there was so much hope and optimism with red, I think they can be persuaded that to try gray with limited openings. But I think red is probably off the table at this point. I was so hopeful. I was so hopeful, but these numbers, I just got the numbers. In fact, I asked him for them so that I could have them for your
uh,
broadcast. And they're
thank you.
just, it's the R factor. Like, as soon as you see something over a 1,
Did Dr. Lowe mention anything about? I mean, I think Toronto was going to move into gray, I believe. I mean, I think that's what they're pointing towards. Was there kind of an issue or kind of a pressure there to keep Mississauga and Peel and Grey as well, just because of all the back and forth that would have happened if, if one was red and one was gray?
I hear you. I don't think that was the issue as much, because certainly Oakville, Halton is open, and York, Vaughan is open. And certainly York had similar numbers to what we had, case numbers have, because they were 69 cases per 100,000 when they opened. And, today we're at 74. So that's not where the difference is. The difference is always in the R factor. And I think that, the hospitals, while they're keeping their own, Michelle did tell me they still have transferred up some patients. Elective surgeries aren't quite where they should be. So we understand that. She said, look, we're holding our own. But, obviously better to be safe than sorry. And Dr. Lowe always is very cautious, and we, this is his professional integrity. So of course he wants to do what is right for our well-being. So I just got the numbers. You can see I'm a little bit disappointed. I looked down with a heavy heart and gave a big sigh, and kind of feel a little deflated at this moment, because I was so hopeful. But I guess the VOCs, the variants of concern, are taking hold, and from what I understand, do cause more hospitalizations and severe symptoms. So yeah, I don't think he would have kept us closed if our numbers had warranted to be in the red. He would have allowed us, but we're not there. Okay. Unfortunately, we're not there.
Gray zone would be kind of looked at every 2 weeks. Is this correct? Kind of
reevaluate? Absolutely, every 2 weeks. So we still have that opportunity. I'm hopeful for gray zone. I think that looks pretty good at this point. And so we will get some retail opened, but it's not the retailers that have been texting me and calling me. It's the restaurateurs. Do we get the kitchen set up? Do I recall staff? And I said, just wait a little bit. Just yet, just wait, and I'll let you know. So, I mean, he hasn't, I believe he sends his recommendation to Dr. Williams today for tomorrow, and then the caucus, then they discuss it at the provincial table, and then the provincial team, including the premier, make the decision on Friday. They'll announce it Friday. But at this moment, let's just assume we're going into gray, not red.
Okay. Okay, let's talk about vaccines now. A lot of positive, I guess you can call it positive news when it comes to vaccine.
Yeah, absolutely.
I got 1,000 questions about vaccines. Let's start with who can get vaccinated right now?
Any essential frontline healthcare worker, including paramedics, firefighters, police, anyone who works in a hospital, any resident of a long-term care home, any resident of a senior's home, 80 plus, and any of the staff that work in any of those homes. And now we're starting by age cohorts, so that anyone 80 plus can get vaccinated. They can get their name on a list. There are still some supply of vaccines, but I'll share with you, not that many. It would be in the 1,000 to 2,000 doses range. In Mississauga, okay. It's nothing really. It's nothing. So what they're really doing is getting the online registration up and going, so that when this, and I'm told the shipment is to arrive today, tomorrow, very, very soon. Very, very soon indeed. So when that hits, they will be calling anyone who registered to come in and get registered and get it vaccinated. So that's why the online registration is very important. And of course, you can find that many places, on the Peel Public Health website, on my Twitter, certainly on Trillium Health Partners. So anyone 80 plus will be vaccinated as soon as we get the shipment of the vaccine. That said, with the supply, I expect that they are calling in some people. I know that they reached out over the weekend to family clinics, family healthcare practices, to ask them for lists of patients over 80 who would be interested in being vaccinated, and that was shared, and those people were registered. And I think, they are, based on supply, inviting them in to get vaccinated. So people are going in. They are busy. They can do as many as 200 an hour, but they're not doing that many, because of course supply wouldn't last a day. So they're just waiting.
Oh, sorry. Go ahead. So, I was going to say. Okay, go ahead.
The good news is even the UTM site that's being operated in conjunction with Trillium Health Partners can vaccinate 200 people per hour, so over 20,000, and it's open 12 hours a day, over 20,000 per day once we get the supply in. Now, I think in 2 weeks we'll be looking back and remember this as a little hiccup. Right now, it's a big deal for all of us that we're waiting for supply, but once it arrives, you know, we're going to have people lined up ready to get shots in arms, and we'll just remember there was that little period of time where there was a little glitch and that all hadn't arrived yet. So, and of course, the online registration that the province has created isn't quite up and running either. That's not happening till March 15th. And that's why most of the public health units decided to reach out and register people themselves. And then that'll all get placed into the COVAX system, so we have record of it.
So let's be as, I guess, clear as possible. And, you know, you're probably going to sound like a broken record over the coming weeks in regards to the 80 plus. You know, I just hear so much, you know, kind of confusion when it comes to, you know, signing up. Where should I go? Do I go on the computer? I don't have a phone, or, you know, like, so, and there's just so many, you know, I saw one story where a gentleman that was 83 years old drove up with a laptop, you know, and said, how do I register? You know, so I mean, as clear as possible, what does an 80 plus person have to do to register?
So I registered my mom, let's see, and it was on, let's see, I got her on, hang on, let's see if I can find it, because there it is. Let me give you the exact location. Okay, so Trillium Health Partners, THP vaccine registration is what it's called. And so you open it and it says, welcome to Trillium Health Partners vaccine program. If you are 80 years or older, please pre-register here to receive the COVID vaccine. And then it says Trillium Health Partners began vaccinating individuals 80 years old and older in a staged approach on February 27th, 2021, as per direction from Peel Public Health. If you meet both of the following criteria, you can add your name to the pre-register for COVID-19 vaccine appointment. 80 years and older and live within Trillium Health Partners catchment area or are a resident of Peel. If you meet the above criteria, the THP COVID-19 vaccine scheduling team will reach out to book an appointment for you when appointments are available. Within the next week, our goal is to launch an online and telephone booking system. Ask you for your first name, your last name, middle name if you have one, your date of birth, of course it has to be 1921 and more, your phone number.
Do you have to show ID?
Probably.
Yeah.
Phone number, email, and postal code. And by submitting this form, you're asserting the information collected for the purposes of COVID-19 wait list, and you will be contacted by COVID-19 scheduling team. You press I accept and you press submit. All right, so that's what we have right now. Let's see if I open it in the browser, if I get any more information. No, not really. So you just go to Trillium Health Partners and look for, it says op.trilliumhealthpartners.ca, and you look for COVID-19 vaccine. There will be a number to call. I'm sure if you call the hospital, they will direct you.
No, I guess the question is, I mean, let's just say the person over 80 does not have access to a computer, right? And let's just say they might not have access to a phone, right? You know,
you don't have access to either? Okay.
Yeah, like,
well, so I guess you will show up and just to explain your situation, but it's hard to believe that an 80-year-old can get to a vaccine center if they don't have a phone, or will they drive themselves, or will they take public transit?
Yeah, I don't know, but I'm just asking just for, you know.
So the phone number, so the best thing is the phone number to Peel Public Health, which will have more information, of course, 905, of course, right? 799-7700. 799-7700, and you know they'll give you the correct number to call as well.
Will Peel Public Health actively be going out to vaccinate?
That will come once we have a greater supply. So there will be mobile units that will go out. There'll be some drive-through clinics, and you're already aware of the 4 sites we have in Mississauga, correct? Want me to list them? I can list them.
You got it.
71, yeah, 7120 here, Ontario, right? That's on here, Ontario, just north of Derry on the west side. And that clinic was ready on February 11th. All right. 10 Peel Center, that's in Brampton, never mind. Paramount Fieldhouse is ready tomorrow, March 3rd. Okay.
Yep.
The International Center is ready next week on the 10th. And UTM, of course, opened on the 1st. There will be hospital clinics. I think there are hospital clinics right now, and mobile clinics and drive-throughs. The dates I got were mobile clinic underway and drive-throughs in spring 2021. You know what? It's just contingent on supply, right?
Okay. Now, with AstraZeneca vaccine being not recommended for 65 plus, is this an opportunity to kind of get factory and warehouse and essential workers vaccinated sooner?
Right. So I've heard a few things about that. First of all, I think one of the key reasons they don't recommend it for 65 and over is because during the testing, they really didn't have a large sample of people who were 65 and over in the test group. So they don't really know the effectiveness, but maybe we'll learn more in time, because I think in the UK, they're submitting more data now. But anyways, right now, Health Canada has ruled that it's safe for 65 and lower. And yes, and I've heard some rumblings that the AstraZeneca vaccine will be available more broadly when it arrives for everyone. So whether they be the essential workers, and for me, essential workers are the hospital workers, the grocery store workers, manufacturing, etc., are the essential workers. They know who they are, and we know who they are. So it'd be a great opportunity to vaccinate them. And, if it's accessible for everyone, there are large quantities of it. You could even do it in the pharmacies, I would think. I mean, the reason they're in the clinics, hospital run or public health run now, is because they're being very specific. And frankly, it's because there's a supply and demand issue on who the vaccine will be allocated to. And right now it is the cohorts that are the frontline healthcare workers and the essential workers who are like the PSWs who work in the long-term care homes, the residents of long-term care and seniors homes. We have vaccinated people in the high priority seniors homes where there have been outbreaks. They'll do the rest of the seniors homes and the staff that work in those homes, right? Right, and so it will go down if the paramedics have been done, because we are using paramedics, of course, to vaccinate. Firefighters, for the most part, have been done, and Peel Police are next on the list and way down. So they're controlling, and then it's by age cohort, right? 80 plus, 70 plus, 60 plus, etc. So, and that's the reason why we're doing it in a more controlled environment, either through the hospital or through public health. But once the essential workers, so this is the phase 2 now we're entering, right? The phase 1 was the frontline healthcare workers and people in long-term care home. That was phase 1. We are now entering phase 2. Right, we always said March, phase 2, where it's the broader definition of the essential workers, and then the age cohorts, 80, 70, 60, etc. And then hopefully by summer, July, August, before September, it'll be available to everyone, and probably as readily available as a flu shot, either in your doctor's office or in the pharmacy.
Okay. And I know some jurisdictions are targeting kind of senior and high-risk neighborhoods within the community. Will Peel be sending kind of mobile vaccination sites to these areas once we're in full tilt as far as vaccines go?
Right, so that is the strategy for everyone, of course, for us as well. We haven't got the mobile units up and going yet. But as you know, the high-risk areas, certainly the long-term care homes, the seniors' homes that were high-risk, those are any of the congregate settings. So they also, retirement homes, group homes, etc. Congregate settings were given the higher priority. And then frontline healthcare, the frontline workers that deal directly with the public, who put themselves at risk, like of course our paramedics, our firefighters, our police officers, right? And I know that educators like to be on that list. I know that transit drivers would like to be on that list, our factory workers and our grocery store workers. All those people would like to be on that list, and they will be phase 2 and phase 3 after we finish the most critical of the seniors by age cohort.
So Mayor Brown last week did tell me that if supply was here, that he would be willing to open up a 24-hour kind of vaccination center. Is that something that Mississauga would do?
Um, well, sure, of course. We're doing right now. They'll be open 12 hours. I'd like to give those people a break too. Um,
Yeah.
right. I will share with you there is some hesitancy, and so there are some campaigns that need marketing information campaigns, infomercials that need to be undertaken to get the word out. Because right now we are seeing some hesitancy.
Yep. So, and sorry, yesterday you went to the UTM vaccination site. How was that? Did they take you through how people would come in and stuff? And
Oh,
how's it?
absolutely. It's so impressive, and they have it so very well organized. I mean, you walk in, you get screened at two different stations, and you go to the back and you go to a counter, you line up to go to a counter to be registered, and you tell them, you give them your appointment number and your name, and you probably got a confirmation number, and you get screened again, and then you're seated in a lineup to be called to go into the next room, which is that big large gym at the athletic facility at UTM. And then you'll be called and you get taken over to a station. They showed us where the vaccine was being mixed and everything and put into the syringes. Very interesting, and it's very delicate, so they had to be very gentle mixing it. And then we observed a nurse getting her vaccine, and she said it didn't even hurt, so it was very impressive. There were two women seated ready to be vaccinated. I said, okay, you don't look like you're 80, so you must be a healthcare worker. And yes, they were both nurses, and we were very happy to hear that, and they were very thrilled to get their vaccine. And I'll share that if you're going to be vaccinated, there is no charge for parking as well, of course, whether either at UTM or the hospitals if you're called into the hospital to get the vaccine. And don't forget that the hospitals and UTM are the two sites that have those refrigerators that can accommodate the negative 75-degree temperatures at which Pfizer has to be stored at.
Okay.
So that's why they were given the Pfizer, and they have some Moderna, but primarily the Pfizer vaccine at Trillium Health Partners and at UTM.
And that UTM facility will be a vaccination center all the way till September, or whenever people totally get vaccinated?
You're asking me, I believe so.
Okay.
I believe so. I think there will be a time where the majority of people have become vaccinated and will move into the doctor's clinics and the pharmacies, much like you get the flu vaccine. And I see that happening in the fall. I don't know that we'll keep those centers, the mass vaccination centers, up and running once we've vaccinated whatever percentage of population is deemed that we've satisfied. What do they call that? Herd vaccination, and that everyone else can easily get their vaccine more locally, either at their doctor's office or at a pharmacy.
Okay, perfect. That was the end of my vaccination questions. I got a bunch of viewers' questions. Will there be a decreased capacity in malls or in stores in the malls? I guess, will malls be open next week if we go into gray zone?
Yeah, yes, they will. And there's pretty strict capacity limitations, right, on malls. The things that won't be open, we'll be able to gather 10 people rather than 5 outdoors, and 25% capacities in retail. What won't be open will be indoor dining in restaurants, well, indoor or outdoor dining in restaurants, gyms, and personal care services. So no hair, no nail salons yet, no tattoo parlors. That keeps coming up. People ask. Not yet. Not till at a minimum red. Mm-hmm.
Another question we have, will Peel be operating spring break and summer camps this year?
So the March break, I think, was moved to April, if I'm not mistaken, right? And really, the reality is it'll depend what color framework we're in, right? If we're permitted to have people in our recreational facilities, because we can't in gray. I'm trying to remember if we could in red, maybe red or orange we could. So there's possibility of camps if we're in the right color framework. So we haven't made that decision yet. It depends.
Okay. Another question we have, this one's kind of a fun one. Well, I mean, Netflix said they want a head office in Canada. Is Mississauga making a bid for a Netflix office or studio in Canada?
Wouldn't that be fantastic? I didn't know. Why don't they send me the information? I'll call up the CEO right away. I would love that.
Do it.
We now have 8 film studios in Mississauga. We are Studio City North.
Nice.
We have
So,
8. We announced another one a couple weeks ago. We have 8 film studios in
nice. Let's get
Mississauga.
Netflix up there.
Wouldn't that be great? Oh, tell that person to contact my office, mayor@mississauga.ca, and we'll get right on it.
But you haven't reached out to them to make a pitch or anything?
I wasn't aware, unless our economic development office, sometimes they do these things to sow the seeds and then they bring me in to be the closer.
Okay.
I can be quite compelling as the closer. So they bring me in to just, finalize the sale and say, hey, so what do you think? Mississauga it is. We're happening.
So here's one, and I didn't write this, okay? Does she like... Okay, so there's a question from our viewers. Does she like our citizens getting marijuana from the black market? I guess meaning that...
I understand. We opted out. We're not opted in. You can't retail cannabis in Mississauga yet. However, we have been doing some work behind the scenes, and we've been speaking to... I told you I can't bring back a motion if we can't win it. So we have been doing some work behind the scenes to speak to our councillors about their reservations, and sometimes these just take time. I mean, we're very cautious. We like to do our homework. We made some specific asks of the province about zoning and sensitive locations, and they're not going to give us the right to choose the zoning or the locations or the concentration of numbers. However, we've observed the experience in other municipalities, and we've learned that there haven't been a lot of issues, frankly, and mind you, not many of the licenses had yet been distributed, but they're more and more we see the licenses are being distributed. So what we have seen from the observation from others, that it has been very smooth, and I was the one who opened up the weed maps and showed my councillors that the black market, gray market is alive and well, and largely because the price of the product, and because, of course, we have not allowed the retail of cannabis products in Mississauga. So I think we have the votes now.
Okay.
We've got 2 on the fence, but we think they're going our way. And once we can confirm them, we'll bring back the report and have the discussion. But I keep it being asked all the time, and I keep saying, well, if I reintroduce it and it's turned down again, then what? Then what? If it's turned down, then we wait another couple years to bring back till things change. So I said, let's just wait. We'll wait and learn about the experience in other municipalities, speak to those councillors that have reservations, and when we think we have the votes, we'll bring it back. So I think at this point we're in a position where getting phone calls, and in a position to, I know, these people know. Hey, this is my Hollywood moment. I'm on Saga Live at 4:30 till 5 every Tuesday.
You can talk about anything you want on this show, and there's no time limit other than your time limit.
Apparently, I do talk about anything I want. My staff are always cringing. This is their cringe moment when I'm on with you, because they say, "Oh, Mayor, you're so forthright. You never know what you're going to say."
And you got the memo today. We're both wearing red, so.
Well, this is a hangover from this morning's State of the City address.
Okay.
Because I saw their backdrop and it was quite colorful, and I had always planned to wear a navy or dark suit, but then the backdrop was quite dark, and so I needed something to pop. And you and I both like red, so I said red will pop.
Yeah, true.
So this is what I wore for the State of the City. I'm sorry you missed it. I hope you can go back. I put a lot into it.
I will look at it.
You will go back and look at it. We do a slide presentation, so you don't have to look at me the whole time. There are interesting slides all around the city for the different developments and the different investments, the infrastructure, the transit that we talk about. It actually came off very well. Every department, every staff department contributed to it. So I think we did a great job.
Believe it or not, I look back, I saw your 100-minute Hazel McCallion tribute. I actually watched it.
Wasn't it great? It was good. I think I had that jacket on too.
You did it.
I know. And I heard that if this mayor thing doesn't work out, I can probably do MC thing. Maybe I come work for you.
You totally can. You can, yeah, you're a better interviewer than I am, so. So,
I like to
but the
turn
mayor,
the tables on the interviewers and ask the questions. You know that.
I think the mayor thing's working out pretty well. So,
Thank you. Thank you.
all right,
Thank you.
that's all
So
I
I
have.
hope you'll go back. I hope you'll go back and take a look at the Mayor's State of the City address. It'll be on the Mississauga Board of Trade website, and it'll be very informative, and I hope very inspirational, because it was a tough year. Oh, the last thing before you let me go, we need to talk about COVID heroes.
Okay.
So this is a campaign that has been fermenting in my mind for some time, to recognize and honor the people who really have gone above and beyond. And there are so many of those people in our city, whether they're businesses that retooled quickly to produce face masks or shields, face shields, or raised money to buy PPE, or we had residents that gathered to prepare meals or to deliver meals or sew masks or just help out elderly or people in need. There are so many people that we're all aware of them. They're individuals, they're organizations, they're companies, and they went above and beyond in their spare time to make life better for individuals who are more vulnerable, and as a result, our city as a whole benefited. So I want those people to be recognized. We've talked about our frontline healthcare heroes, and of course they are, but I want to more widely recognize the COVID heroes in our city. Those people who demonstrated the spirit of Mississauga, who went above and beyond to do something, and I want you to nominate them. Just send in a nice little 300-word why I chose this person and what they did, and make sure that they agree. Submit it to the city, and we're going to announce them for Volunteer Week in April, the end of April, and we're going to have a big new structure at Celebration Square that's going to say COVID Heroes. They're all going to be invited to go get their pictures there, and there will be a ceremony to pay tribute to individuals. Of course, they'll all get certificates, and I want to honor them in a more permanent way at some point as well. I'll get all their names etched on the wall somewhere. So this is a really big deal for me, because I know of so many people and so many loose organizations, groups that came together to make a difference. And I want to be sure that they are honored. So COVID heroes, I want you to put a shout out to those people, to nominate their friends, or we're all aware of. The one that comes to mind, because I know those people involved, is the Feed Mississauga group. Slavica Bislas and Dan Meadowcroft, and they go up to the Mississauga Convention Center, worked with Cliff Silvieri and Ann Boyd, and they'd be preparing 400 meals every weekend for people in need. Like, that's the kind of group. Or the people who sewed masks or retooled to create PPE. So many worthy individuals, groups, and organizations. Please nominate them, send them into the city. It's all over my Twitter and Facebook, everywhere, to get more information. Sure. And let's get them recognized for the spirit that they showed in a year that was otherwise quite dark.
Awesome. We'll write about it too. So
thank you.
We'll get it.
COVID heroes.
Cool. All right. I know it's 5:03. See you later.
Thanks very much.
Take care.